much of this work stems from Bish Chera, who's a radiation oncologist at the University of North Carolina, and colleagues in the South. These multidisciplinary academic centers participated in studies looking at the NavDx profile at baseline among patients newly diagnosed with HPV-associated oropharyngeal cancer. And the idea was to see if there were circulating tumor DNA metrics, clearance metrics, as the patient was treated for their HPV positive disease, but also to understand baseline values and the possibility of detecting recurrence. The graph at the left really summarizes both visually and in text what was compelling about these data. So there was a 97% specificity or ability for the test to rule in the findings of HPV DNA and 89% sensitivity, which we often think of as higher numbers ruling out disease. And the graph really sort of depicts what is of most interest. In the 115 control patients, again, healthy volunteers and those with non-HPV associated head and neck cancer, almost all had non-detectable HPV DNA based on the TTMV plasma assay. However, patients on the right side of the graph, highlighted in pink, were those with P16 positive or HPV-associated oropharyngeal cancer. And dots in red indicate those with subtype 16, which, as you all recall, is the most common high-risk subtype linked with oropharyngeal cancer. But there were a smattering of other patients who had other high-risk subtypes like 18, 31, 33, and 35, which are included in the assay. So the assay detects those 5 high-risk subtypes. And what you can see is at different ranges of values shown here in copies per ml, at baseline, we are able to detect in the vast majority of patients HPV positive circulating plasma DNA fragments. Essentially, what they demonstrated was that patients who had HPV DNA values of greater than 200 copies per ml at baseline, and who over time at 4 weeks into treatment, so again, these are chemoradiation or radiation patients on deintensification protocol, if they cleared their HPV DNA baseline value by 95% of the original value and had that above 200 copy number at baseline, that was associated with favorable outcome as shown in the regional disease-free survival curve on the right. And essentially, if you paired that with clinically high-risk features and flip it, so if someone had less than 200 or equal copies at baseline and did not clear the HPV DNA within 4 weeks of treatment by 95%, those two features, those kinetics, along with high-risk clinical features like a T4 tumor, stage T4, or greater than 10 pack year smoking history, those patients had a less favorable regional disease-free survival as shown in the teal curve on the graph. So what we're starting to see here is, even though this is early data, the emergence of a clinical and a complementary HPV kinetic profile that may identify patients at higher risk.